But now it's time to move on to one of our favorite segments. It's What's Up, Doc. We do it every Thursday at 8:30. It's sponsored here by Mercy Health. And today's guest is Ms. Laura Hunter. She's a nurse practitioner at Mercy Health Roscoe and Mercy Health Alpine. Good morning, Ms. Hunter. How are you doing?
Good morning. I'm doing good.
That's awesome. Before we get going into our things here, we always like to do a little get to know our guests here on the show. So give us your bona fides. Where you're from? Where did you go to school? How did you get into this? What's the little first paragraph of your resume look like?
Oh, wow. Okay. Well, I am an Army brat, so I'm not really from anywhere.
Okay.
But my grandparents were from Rockford, and my parents thought it would be important that I had some stability. So I would come to Rockford every summer, and then eventually met my husband in Rockford. So that's kind of how I ended up here. So I didn't go to school anywhere around here. I went to school in New York, and then I got my master's at UIC. And then I started out...
The Flames.
Yeah. I started out at UIC. I started out as a labor and delivery nurse, and I did that for probably 10 years, and then I was never interested in being a doctor. I know this is called What's Up, Doc, but as a nurse, I kept having all these women delivering babies that were really, it's a sad story, but very not wanted, or a lot of drug-addicted moms, and I kept thinking, all right, there's got to be a way to get to the point where I'm helping prevent these pregnancies as opposed to just delivering them.
Right.
And then I found out there was it's called a women's health nurse practitioner program. So my specialty is just women's health. So all I do is gynae and OB.
Sounds good.
So that's how I got to this point. So now I give a lot of birth control out and try and educate about not having unplanned pregnancies.
How long have you been in this field of medicine?
15 years as a nurse practitioner, and I was a RN for 10 years.
Very, very good. Well, you're here specifically. My paper tells me, we might get into other stuff, but my paper here tells me we're here to talk about is Breast Cancer Awareness Month.
Yes.
If you're not aware, that is all October, and we're here to talk about early detection and our best defense. Real quick, remind us, what are the risk factors for breast cancer?
Well, the main risk factors are, number one for women is the older we get, the more likely we are to get it. So basically, once you get over 50, the risk starts to become higher. Certain women have, and hopefully they would know this, there's a genetic mutation called a BRCA. I don't know if you've ever heard of that, but if someone has a family history, so say a woman comes in and says, my mom, my sister, my aunt, ideally we would want those people, and they probably would have already done it, had a genetic test to see if they have a genetic predisposition to it. That's a huge one if there's like a family history of this genetic mutation that can cause breast cancer. Some of them are just about age. So breast cancer has a lot to do with like estrogen and genetics and environmental, but our age. So if a woman starts her periods when she's really, really young, so say she's like 8 or 9, and then she has them for, she doesn't go into menopause until she's, say, 53, 54. She's had many years of high estrogen exposure just from her body, so that makes a higher risk. Sorry, I'm going through
No, it's good.
Another risk factor, and I might be going around in circles, but one of the most important things I tell my patients when they get their mammograms now is look at your report, because we have to now, when a woman gets her report sent to her, it will tell her the type of breast tissue she had. There's terms like fatty, there's terms like dense, there's terms like fibroglandular, and women that have very, very dense breasts are at a much higher risk for breast cancer.
Really? Does that break down into like a percentage?
Well, they don't give an exact percentage, but we have found the women that have very dense breasts and they're older, dense means like they're really thick and full.
Okay.
And I have women that'll say, well, my breasts seem really saggy. How can I have this dense breast tissue? But based on the x-ray, when they look, they see this very thick, compact tissue. So one of the problems, it's hard to see through. So when they do the mammogram, we can't really get a good picture. And the other theory is that the tissue is so compacted together, cancer just loves to grow in like tight groupings. Like if you have a bunch of tissue kind of growing out of control, cancer just loves to get in there and start growing for some reason. But to me, one of the more important things for a risk factor is if you have dense breasts, that's something you can look at on your mammogram. And now what they're recommending is that you also get an ultrasound if you have that.
What would that be called on your report?
It would literally say, like I'm looking at one right now, it would just literally say you have... it will say dense breast tissue noted, or extremely dense, or fatty, or fibroglandular. And a lot of, like I'll see women that have seen their family doctor, which is great, but they'll have had mammograms that have said that, and they may not be aware that that's an issue or a risk factor. So most insurances will cover an ultrasound also for those women. So it's I just tell them, be proactive. Look at your mammogram report and read the report. And usually at the bottom it will say something like, because you had dense breast tissue, you could consider an ultrasound. They're not saying it's that you have to do it. They're just saying consider it.
Is a mammogram the only way to figure out what kind of tissue we have?
Yes. Okay. Basically, yeah. Unfortunately. But that's a big one that is newer that we're realizing more and more, that the type of breast tissue. And again, it gets a little confusing because young women who are having periods. So if I have a 45-year-old patient with dense breasts, it's common for her to have, or she's going to have dense breasts because she's young and she's still having periods. But when I have a 57 or 60-year-old woman who's been in menopause for 10 years, if she has dense breast tissues, my radar, my red flags for her breast cancer risk is like way up high. Like I'm wanting her to get one every year, a 3D, an ultrasound, any modifiable medications, weight, whatever we can do to help reduce that risk, because at 60 they should not be dense anymore. And if they are, it could be an issue later.
We've talked a lot about genetics and things you're born with and timing of periods or whatnot. Not necessarily things that women can change or anything. Are there any risk factors that women do have control over?
Well, the main one is our weight, because fat, and I can't talk, I'm just like everybody else, but the more fat we have in our body, fat actually turns into estrogen, which is why like men who are overweight can get like the breast tissue mastodynia, and even it's very rare for men to get breast cancer, but there's about a 1% rate, and it's typically in men with a lot of body fat, because again they're making their own high estrogen levels. So weight loss is the number one thing we can do. Hormone therapy, that's a different scenario. There's a lot of different schools of thought on that, but certainly if you're on hormones for more than 5 years, that would be something you could modify. Not being physically active. We just see basically for breast cancer reduction, a lot of it is about weight and exercise, and just like any other cancer reduction that's out there, we know that as much as it is not much fun, but diet and exercise, healthy diet and exercise seem to be the key for so many things.
Hey, we talk to a doctor or nurse every week, and that's an underlying factor for pretty much everything we've talked about. Is basically just keep the rest of you healthy, and it'll keep some of the parts. It really
does. I mean, there isn't anything. There's no magic pill for this. It's kind of, and I can say this honestly. I have more patients with breast cancer that have absolutely no reason. I have no reason why. So to me, that I can come up with why they have breast cancer. The most important thing is for women to get their mammogram done. And right now with COVID, I know for a while some of the clinics and hospitals, we weren't doing anything if it wasn't emergent. I would want to stress to all people, do your preventative health care. Go in and get your checks. If you think you have something going on, don't be afraid to go to the ER or wherever you have to go to get checked out, or your doctor's office. Just go in and be proactive about your health, so that because the idea of breast cancer or the mammogram, honestly, mammograms do not prevent breast cancer. The idea is that we catch it when it's tiny, and then if you catch it when it's tiny, you can get rid of it, and then the rate of women doing very well after has become, just astronomically high if you catch it when it's teeny tiny. We don't like to catch it when it's a huge mass and it's spread all over the place into the lymph nodes.
We still recommend doing self-checks at home, and how old should somebody be when they start doing the self-checks?
Well, so the general consensus across the board is that the self-checks are not helpful. So what the big experts say is that the self-breast exam has never been proven to reduce risk. What we in healthcare say, though, it is absolutely. I'm telling patients at 18, I want you to get in the habit of reaching around, feeling around when you're in the shower, just so you know what's normal for you. Because most of the time, the women are going to find, or their partner are going to find something that seems different. So I highly recommend a monthly, just while you're in the shower, just feeling around, because over time you're going to know, oh, this is my normal lumpy, this is my normal lumpy, and then, oh, wait, what is this? This has never been there before. So I absolutely recommend doing them, self-breast, starting as soon as they have breast tissue. 18, 19.
Sounds good. Talking to Ms. Laura Hunter. She's a nurse practitioner over at Mercy Health Roscoe, Mercy Health Alpine. Somebody wants to make an appointment to get checked out, talk to you. How do they do that?
They can call. It's 815-971-DOCTOR, or for me, it would be 815-971-3340. We have a lot of exceptionally good healthcare providers here. But again, I really want women to not be afraid to come in. Get your screening exams done. Just anything that you would normally be doing pre-COVID, please continue to do. And don't, especially with breast cancer, the key to this is catching it early. So, feeling around, getting your mammogram done, seeing a provider that also does a breast exam, because between me doing a breast exam, her doing a breast exam, and getting a mammo, the odds that somebody might catch something it starts to go up.
Real quick before I let you go, where are we with breast? I mean, we've talked a lot about detection and getting tested. Unfortunately, if we do catch cancer, wherever it is along the way, where are we today compared to 10, 15, 20 years ago? Like how much better shape is somebody in being caught right now than we were in the past?
I mean, I don't have the statistics, but just much, much better. If we catch it early now, I mean, no one will ever say the word cured, as far as I know. I don't think any of the oncologists use that term, but if you have a patient and you catch it early and it's gone, I mean, and they're clear within 5 years, it seems like the reoccurrence rate is very, very low. We're seeing much higher rates of women in the last 10 years coming in for mammograms. I don't like to talk about politics, but the forcing people to get health care was huge, because we had women that hadn't had mammograms or breast exams for years that were finally coming in. So we are actually doing a much better job than we did 10, 20 years ago at catching this early and treating, and women living a long, healthy life after.
Makes a lot of sense. Nurse Laura, anything else you want to add before we let you go here?
No, I just, be proactive about your health. Get in and fight for your rights. If you think something is wrong, I've had women be like, I'll feel something and say, I don't know, it feels okay to me. And if she's like, no, this is different, I want, a mammo, I want an ultrasound, I want this checked out. Don't let any doctor or nurse practitioner tell you not to. If you feel like something is wrong, at least, once we do all the tests, if it's still normal and it's just in your mind that there's something wrong, that may not be the case, but there's nothing wrong with coming in and just saying to your provider, something seems wrong, I want you to check this out. This is different for me.
Outstanding. Learned a lot here. Thank you for joining us. As Nurse Laura Hunter out at Mercy Health Roscoe in Alpine. Thank you for your time.